Hi friends, good morning. This is 2nd of May 2022 and we were talking about multiple sclerosis yesterday. So continuing the talk, today we are going to discuss the common symptoms of multiple sclerosis. So as I discussed yesterday, it can be because of the involvement of the central nervous system, the eyes nerve, that is the optic nerve, the brain, spinal cord, and the damage incurred because of the abnormal immunity in the form of swelling and further damage to the nerves processes called axons. Now the most common form of MS, that is the RRMS, the symptoms usually comes in attacks and they last for 24 hours at least to be called as an attack because of MS or any major neuroimmunological disorder. The common symptom because of the eye nerve involvement is the optic nerve swelling, which we call as optic neuritis. It's a diminution of vision from one or both the eyes. So it can be unilateral optic neuritis or it could be a bilateral optic neuritis. The former, unilateral optic neuritis, is much more common with multiple sclerosis, and this is also associated with painful eye movements. The other common symptoms because of the brain include imbalance while walking or incoordination of one limb or tremors. Then there would be the weakness of one limb or one-sided limbs or both the lower limbs because of the spinal cord involvement and with or without blood involvement. So the blood involvement is usually in the form of urgency, and somebody has to rush to pass the urine once they get the urge to pass. Then the stiffness, spasticity is very common. Now people also often complain of fatigue. Now this fatigue is pathological. That is, it is out of proportion to the activity that has been performed, and it is not what all of us experience at the end of the day. So there can be, on a bad day, this fatigue can set in anytime early on also, and so there are some neurological symptoms which are site dependent, and there are certain non-motor or symptoms which are classically present in multiple sclerosis. Now there is a worsening of these symptoms with heat, what we call as Otoff's phenomenon. Now if these symptoms are usually not present, all of them are present at one point of time. They can be disseminated in time. So if, depending on the site, which are different and which we call as dissemination in space, they happen in a different time frame, which we call as dissemination in time, then we call it as, and we suspect, multiple sclerosis. So this is all for today. We'll come back tomorrow and discuss how to establish the diagnosis of multiple sclerosis. Goodbye till then. Have a nice day. This is Dr. Manish Mahajan, consultant neurologist from Gurgaon and head of neuroimmunology. Have a nice day.